It can happen in a variety of ways. On the job, playing sports, or just normal everyday activities, and about 75% of the general population suffers from them. And regardless of how they occurred, they can interfere with all aspects of a person's life.
Soft tissue injuries really happen in two ways. One is insidious, becoming worse and building up, over time. Sometimes you don't even know it's happening. You get increasing stiffness and discomfort over a period of time. Or you can have a sudden injury, a sprain or strain which happens quickly and the pain is immediate. You know exactly when that happens. But the results are similar. You can have anything from stiffness to weakness to discomfort, all the way to pain, spasm, even instability. Either one of these injuries can be serious, even causing someone to lose their job.
A doctor can generally assess your injury and grade it based on the severity of the injury. From there, treatment can vary greatly, and it is not always successful.
Now, for years, we have treated these soft tissue injuries the same way. We've used ultrasound, electric muscle stimulation, various massage treatments. The reason these treatments are not effective is because they don't get to the core of the problem. That's why when you have a soft tissue injury like this, you tend to have it forever. It's really hard to get over it.
The area of soft tissue injuries has mainly been glossed over. Science and healthcare are very competent in many areas, especially pharmacology and radiology. Unfortunately, when it comes to the soft tissue injuries, most of the therapies are nebulous and ignore the science behind soft tissue injuries and how and why they occur.
The science of soft tissue injuries up until recently was really underdeveloped. Unlike radiology and pharmacology, where we put in so much time, money, and effort, this is really underdeveloped comparatively. But some good research has come about in the last 5 years, and now we're really getting somewhere. We understand what happens at the cellular level, and that's leading us to some real breakthroughs on how to treat it.
One treatment modality that has proven to be very effective in treating the soft tissue injuries is ART, active release techniques.
ART is a completely different way of looking at soft tissue injuries. The reason it is so successful is that it gets to the core of the problem. The cause is not inflammation, which we thought for years. It's really hypoxia, or lack of oxygen to the tissue, causing scar tissue to form. This changes the texture, tension, and movement within the tissues. ART is a way now to find it with the hands, release it, and change those three things, so you now have a solution to the problem.
Hi, I'm Honora Cosley, and I'm a patient of Dr. Bradshaw's. I came to see him about 3 years ago after I had been suffering from chronic pain for over 20 years. I had a pinched nerve in my neck that radiated pain down my right arm that prevented me from doing all the things that I enjoy in my life. After seeing him for a short time and him doing ART on my neck and my shoulder, I was amazed at the results. My body has started to heal. I am now enjoying drawing, painting, working on the computer, and doing my yoga, all the things that I enjoy. Thank you, Dr. Bradshaw. ART was created, refined, and patented by Dr. Michael Leahy, an Air Force engineer turned doctor. Dr. Matthew Bradshaw was introduced to ART and Dr. Leahy 10 years ago, changing his career path.
Dr. Leahy taught me that there's much more to treating the patient than just realigning spinal bones and joints. The soft tissue components of these injuries is critical to fixing them. The hands are the most important aspect of using ART because it is the only way to find these problems in the soft tissues and then of course to fix it. You won't see it on an x-ray. You won't see it on an MRI, but that is where the problem is.
By observing how muscles, fascia, ligaments, tendons, and nerves responded to different types of work, and through Dr. Bradshaw's use of the ART technique, he is able to consistently resolve 80% of his patients' problems.
Dr. Leahy, the developer of this technique, is almost batting 1,000 in terms of fixing his patients, and I'm not quite there yet. But I've been using ART for 10 years, and 8 out of 10 patients get better in my office.
Soft tissue injuries are no longer something you just have to live with. Active release techniques can offer great and lasting relief for a variety of these injuries. To schedule an appointment with Dr. Bradshaw or just a free consultation to ask some questions regarding your condition, please call 910-859-8359 or go to kairosynergy.com for more information.